Hi Healthy Body, I'm Dr. Tirta, a licensed medical doctor. Welcome to my channel where we will talk about various health matters. Today we are going to talk about high blood cholesterol. It is a silent health condition associated with heart diseases and stroke, the top causes of death in the world, according to the World Health Organization. Blood cholesterol is a waxy, fatty substance produced by our liver. It has important jobs in our body like making hormones and digesting food. Normally, we are able to produce all the cholesterol needed by our body ourselves. We do not need to get it from external sources. Any cholesterol in food we consume is extra. Blood cholesterol is measured in milligrams per deciliter. A common set of cholesterol tests is checking LDL, HDL, triglycerides, and total cholesterol. LDL, or low-density lipoprotein, is also known as bad cholesterol because having high level of LDL is cause plaque buildup in our arteries and is increasing the risk of heart diseases or stroke or both. On the other side, HDL, or high-density lipoprotein, is known as good cholesterol because it keeps LDL from sticking to the artery wall and reducing plaque formation. High level of it can lower your risk of heart diseases and stroke. Triglyceride is a type of fat in our blood being used as energy. The combination of high level of triglycerides, either low HDL or high LDL levels, can increase our risk for heart attack and stroke. Total cholesterol is the total of these above. This is the number we usually get if we do the simple finger prick cholesterol testing. Someone is considered to have high blood cholesterol if the total cholesterol level is above 200 mg per deciliter. The medical term for this condition is hyperlipidemia, where hyper means high level and lipid means fat. Another medical term for cholesterol problem is dyslipidemia, which refers to other cholesterol abnormalities even when the level is not high. For example, very inflammatory cholesterol particles or an abnormal balance between HDL and LDL. High blood cholesterol leads to a buildup called plaque on the wall of our arteries. For your information, artery is the blood vessels carrying blood away from our heart. The one carrying blood to our heart is called veins. The plaque buildups in our arteries are narrowing the blood vessels, eventually blocking the blood flow from our heart, causing chest pain, that we call angina, then heart attack, also known as myocardial infarction, arrhythmia or abnormal heart rhythm, and heart failure, then stroke. By definition, stroke is a condition where our brain cells are dying or dead because of blood deprivation. People with narrowed artery have higher risk of stroke simply because it is easier to be blocked. Our brain and heart need constant supply of blood for our survival. Blood deprivation in these vital organs can be very dangerous, even fatal. Therefore, we need to keep track of our cholesterol level to prevent hyperlipidemia. If we have it, we need to do something to reduce it. There are various causes of hyperlipidemia, includes genetic or inheriting genes that make our cholesterol levels unhealthy. This is non-modifiable cause. We are born that way. Fortunately, most causes of hyperlipidemia are modifiable. We can do something to change them, like the next causes, like unhealthy diet, high in saturated or trans fat. Saturated fat is the type of fat molecules that are saturated with hydrogen, so they are solid at room temperature. Most saturated fats come from animal food products like beef, lamb, pork, butter, cheese, etc. Trans fat is the type of unsaturated fat that contains a trans fatty acid molecule. Industrial trans fats are made by hydrogenation to stabilize polyunsaturated oil to prevent them from becoming rancid and keeping them solid at room temperature. Trans fats are found in margarine, donuts, cookies, fried foods, and the likes. Number 3, sedentary lifestyle. And 4, smoking or vaping and consuming alcohol. Number 5, emotional stress. Number 6 is some medical problems like obesity, diabetes, high blood pressure, polycystic ovary syndrome, sleep apnea, HIV infection, hypothyroidism, and etc. Number 7, certain drugs like beta blockers, diuretics, hormonal birth controls, steroids, antiretroviral for HIV, etc. Some people who have genetic problems causing very high level of blood cholesterol may have xanthoma or corneal ulcers. They are not reliable to detect hyperlipidemia, however, because most people with this condition do not show any sign at all until it is too late. That is why it is also known as the silent killer. At the beginning, most, if not all people with hyperlipidemia feel normal without any symptoms at all. After a while, when the arteries are narrowed by the plaque buildup, the blood flow from the heart and to the brain is slowed down. This can cause shortness of breath and heavy feeling, burning, or pain on chest during physical activities or emotional stress that may radiate to the jaw and back. Without proper examination, these symptoms are quite similar with those of gastric reflux or peptic ulcer disease, panic attack, even neuralgia. Sometimes a cholesterol plaque ruptures, then a clot covers it in order to stop the bleeding. And sometimes the blood clot completely blocks the entire artery. If it happens in the heart, it is called heart attack. And the symptoms are severe chest pain, flushing, nausea, and breathing difficulties. This is a medical emergency. When the blood flow to the brain is compromised because of the blockage, the brain cells are dying, and we call it ischemic stroke. The patient must be diagnosed and get proper treatment within 3 hours of the first symptom in order to get optimal outcome. If you think someone may be having a stroke, be fast and do the following. B is for balance. Is the person losing balance or feeling dizzy or having headache? And E is for eye. Is the person having blurry vision or other visual disturbances? F is for face. Check whether there is any facial asymmetry where one side of the face is drooping. A is for arms. Ask the person to raise both arms and check, does one arm drift downward? S is for speech difficulties. Is it slurred or strange? And T is for time. If you see any of these signs, call the emergency service right away. It could be 911, 112, 119, 999, etc., depending on your country of residence. Find out this important information and memorize it. Do not go to the hospital yourself, as it may delay the treatment. Stroke is very time sensitive, and proper treatment must be started as early as possible. By calling an ambulance, the treatment can be started early, even before the patient reaches the hospital. Next, we will talk about diagnosis, natural ways to lower cholesterol level, and medication for these conditions, and the complication if it is left untreated. If you like this kind of information, kindly like and subscribe to this channel for weekly doctor-approved health education. We are building a community of health-conscious people making informed choices. In addition to physical examination, personal and family medical history, doctor will need lipid panel tests to know our cholesterol levels, which are LDL with ideal level below 100 mg per deciliter, HDL with ideal level of more than 40 mg per deciliter in men and more than 50 mg per deciliter in women, and triglycerides with ideal level is less than 150 mg per deciliter, and total cholesterol, which the optimal level is about 150 mg per deciliter. The most important therapy for hyperlipidemia is healthy lifestyle. Some people can improve their cholesterol level just by living a healthy lifestyle consistently. Medications can be added if patient's condition cannot be controlled with healthy lifestyle alone. Do the following for a healthy lifestyle. Number 1, exercising regularly at least 150 minutes per week. We need moderate intensity for the exercise to be effective. Number 2, Eating healthy, balanced diet with more fresh fruits and vegetables. Limit red or processed meats or food containing saturated fats or trans fat. Number 3, getting good quality of sleep, about 7 to 9 hours per night for adults older than 18 years old. Younger people generally need more sleep. Number 4, getting and maintaining healthy body weight. Number 5, avoid smoking and vaping, neither as active nor passive smoker. Just don't do it. And do not consume alcohol. Number 6, managing emotional stress. Number 7, do routine medical checkup even when we are not sick, because this condition is silent. Healthy adults may only need to do it every other year, while those with risk factors or older adults may need to do it more frequently. If lifestyle alone doesn't lower the LDL enough, guidelines recommend statins. Doctors may order different type of medicine if the patient cannot take a statin or need another medicine in addition to statin, or the LDL level is extremely high, like in patients with a familial hypercholesterolemia. Patients who are able to control their cholesterol level by living healthy lifestyle do not need medication. But those who are not able usually will need to take it for a long time. As with other medications, statins have side effects. It is prescribed to patients only if the benefits far outweigh its side effects. You need to consult your doctor if you are not doing well with the medicine, so your doctor can adjust your treatment accordingly. You will also need to visit your doctor to monitor your cholesterol level to know whether lifestyle changes alone are sufficient or not, or whether you need medicine. Hyperlipidemia is a lifelong condition. If it can be managed by healthy lifestyle, you may not need any medications, but still have to live a healthy lifestyle for the rest of your life, just like everybody else. If your condition cannot be managed with healthy lifestyle alone, you will need to take your medicine in addition to living healthily, and to keep follow-up appointments with your doctor to manage your cholesterol level to prevent complications. If high cholesterol is left untreated, it can lead to a higher risk or complications with cardiovascular diseases, stroke, diabetes, peripheral artery disease, and hypertension. Okay, let's recap. 1. Hyperlipidemia is a silent killer. Check our levels with a blood test. Number 2. Live a healthy lifestyle to prevent and treat this condition. 3. Take medications when needed under medical advice. And number 4. Consistency is the key. Cholesterol management is a lifelong journey. That is my sharing about cholesterol today. I hope you found this beneficial. If you think this information is useful for your family or friends, please feel free to share this video so it can reach more people who need it and be a blessing. If you have any health-related questions or topics you'd like me to cover in future videos, feel free to write them in the comment below. I read everyone. However, just a friendly reminder, I can't provide personal medical consultation here. It's always best to discuss your individual condition directly with your doctor. Please remember to like this video and subscribe to this channel to get more content like this. Thank you for watching and supporting this channel. See you in the next video. Stay healthy and happy.